times have you heard people that are advocates of like some sort of state socialistic effort? And what I mean by that, it's for the general welfare of the people that are within a geographical area. They feel as if should not be left up to private hands, private actors, and markets. They believe that government should be in charge of this. Now, this extends to a multitude of different things. The topic of today that I want to, or rather this segment that I want to highlight, is in healthcare. But how many times have you heard those state socialists, in the event that they already control basically, if not the entire thing, most of it, they control the direction that it goes in? How many times have you heard them basically come out and say when their shit fails, or there is some sort of economic kickback, or it's not the utopia that it was promised, that they still, despite controlling it, despite having such a regulatory burden on it, or outlawing the fact that there are alternatives, they go and up and blame the free marketers, or they basically say that, well, it's because we don't have even more control that it's the reason. Imagine that, and you've probably heard some of this stuff going on right now in Canada. A reason I want to talk about this here, this is going from the Mises Wire. Trevor, who's Schleihoff, I cannot pronounce his name, but he talked about this, and I want to go through some of this really quick. You can get this over at Mises.org. If you're not listening, or rather reading up on Mises.org, so much information, definitely from my philosophical standpoint, that you can get over there. It's the best in the business. But he starts with, for the past 16 months, headlines have been broadcast across our televisions cautioning us that the elderly and vulnerable populations are at most risk for life-threatening COVID-19 virus. If we do not stop the spread, despite preventative measures, long-term care homes have been hit the hardest by the pandemic. In Ontario, of the approximately 9,000 deaths in the province, 41% occurred in these homes. That is a lot, guys. A little over 40% of the deaths, of the 9,000 deaths that were in this area in Ontario, Canada, 41% of them were happening basically in these nursing homes and nursing facilities. The people they said we were doing all of this for. The public response to this tragedy has become a growing outcry to nationalize, or rather have the province make all residences publicly funded and controlled. The worst part of this rallying cry, noble as it may be, is the assumption that long-term care homes are private to begin with. In reality, the only thing private about long-term care is in their name. So another instance of, it's kind of like what we deal with healthcare out here in this, where they say, well, XMO costs so much because of the private sector. And it's so hilarious, because you would have to be an economically illiterate dipshit. But more importantly, you'd have to be just completely absent-minded. And not even that, you're ignoring it. The regulatory body that exists right now within that market. So to claim that it is private is being disingenuous. But they use this sort of rhetoric to try to gain even more control. So they blame it basically on private actors, though they have facilitated, like with education in this country, they have facilitated all of what's going on here. Let's continue on with what it is he's saying. These homes are almost entirely funded by the province, with the rest of the costs highly regulated. Doomed from the start, it is no wonder that these institutions collapse under the slightest amount of external pressure. When one says that a business is private, it conjures images of free enterprise and entrepreneurship. Even if that is not the first picture that comes to mind, one likely imagines that the consumer, or in this case, the patient, pays for the services. The unfortunate side effects is that people also think the greedy capitalists murdered my grandmother. Those who think this way are the folks that wish to gallop down the trail to full public ownership. While one can understand the sentiment, the basis of this outcry is flawed at best. Now let's continue on. In the April 2020 budget, the Ontario government spent $5.6 billion on LTC homes, it's long-term care homes. This egregious sum of money goes toward all medical staff, supplies, recreation programs, support services, and even the groceries purchased for the home. The price charged to the residents is effectively an administration fee and covers non-medical support staff as well. The catch to this cost is that the province sets maximum levels for these fees, essentially regulating what extras the homes can and cannot afford. At most, LTC homes are allowed to charge $88 a day for a long-term private room. It should be evident that although the long-term care homes are owned by private entities, using that in quotes, they are hardly private in the economic sense, with the government picking up most of the tab and regulating it at best. The new Democratic Party of Ontario has put together a plan to end for-profit health care. Still, they really have to ask themselves, if the government is already paying for all the medical care and controlling the rest of the system, how will more government control make this better? Although the answer is no amount of further intervention could make it better, it's best to examine why. And if you want to read this further, he goes through and he breaks this sort of stuff down, talking about welfare state. I'm talking about this from an economic standpoint, but I just want to give you guys, of course, my insight on that, because it's the overall theme here that I want to make sure that we focus on. And that is the demonization of private enterprise in instances where it's not actually allowed to exist. See, people think that, well, there's a buyer and a seller, and the state maybe doesn't have full control, much of like what you saw with, as Mises deemed it as the German model of socialism, where it's like the Nazis said, okay, we had these different forms, these different regulators, and they all said, okay, you had to charge this much. If you had to be a member of the party if you were going to own this or even operate or be able to service in this industry. This is how much you had to control. This is how much we get. And basically what it is effectively is that they control it. The state control it, and their own individual actors control it. But people act as if that's private, and it's not. When you have the state that regulates it to hell, when you have the state that either controls a large portion of the market, you could not sit here and blame some sort of downfall or some sort of turmoil that exists on the market when you didn't allow it to exist in the first place. We've seen this so much. I know that we're talking about Canada. I know a lot of people, you've heard these stories of people from Canada that come from Canada to get serviced out here because of the issues that come with the more monopolized forms of the medical industry. But hell, in America, it's not unregulated. It's one of the, along with education, most regulated industry in the country. You haven't allowed, don't let these disingenuous hacks, a lot of them are Marxists, though not all of them, state socialists at best, where they sit here and in the event that there's some issue, they blame it on the free market when the free market was never allowed to exist. You can't do that. When you bitch and moan about the cost of education and you say, well, it's because of markets that have allowed it to happen, when the government is not only involved from the curriculum on down, but the fact that it's involved in the loan and the grant business, which has inflated the price of it to astronomical measures because the schools know that they get the money regardless. Therefore, that's all effective university is anyway, it's just schools trying to outspend each other. But you can't ignore the government's involvement in that when you gripe about the problem. The same can be said for medicine. You look at the patent law system, which is one of the most corrupt. People like to say that's blamed on the market and privatization. No, that is state protected monopolism. That's what it is. When you got people that are willing, have the formula to make cheaper medicine, cheaper medicine, But they can't because it's fucking illegal for them to do so. You have not allowed the free market to exist. You don't get to fall back on that and then say that some sort of problem then exists and it's damn blamed on the marketplace. And therefore the government must take even more control of what they've already controlled. And in all cases, they created a problem. Now, that doesn't mean I'm acting as if everything is perfect, more so in the freer market. No, what I'm specifically addressing, and the point that I'm addressing, is that you can't ignore those instances where these problems are at, and you can't say that it's blamed on the marketplace when the government has been involved in these instances from a lot of industries, top to bottom. You'd be dishonest to do that, but it ain't going to stop these academics who are the first people rolled out any event that you want to get the state out the way. They always roll out the academics to tell you why that's such a bad idea. I wonder why. It's almost as if their bacon relies upon that. You just watched a clip from my podcast, For Canon's Sake. Catch us live at 12 p.m. throughout the week over at youtube.com/YoungRipper59 and follow us over at odyssey.com/@YoungRipper59. If you want to watch the entire video cast after the show is over, just be sure to become a member on the YouTube channel. Of course, the full audio portion of the podcast is available for free on all major digital platforms, or just visit forcanonsake.com.